Welcome to the Dr. Izzy's Medical Podcast channel.
Cushing syndrome. Cushing syndrome is a collection of signs and symptoms due to prolonged exposure to glucocorticoids such as cortisol. Signs and symptoms may include high blood pressure, abdominal obesity but with thin arms and legs, reddish stretch marks, a round red face, a fat lump between the shoulders, weak muscles, weak bones, acne, and fragile skin that heals poorly. Women may have more hair and irregular menstruation. Occasionally there may be changes in mood, headaches, and a chronic feeling of tiredness. Cushing syndrome is caused by either excessive cortisol-like medication, such as prednisone, or a tumor that either produces or results in the production of excessive cortisol by the adrenal glands. Cases due to a pituitary adenoma are known as Cushing's disease, which is the second most common cause of Cushing syndrome after medication. A number of other tumors, often referred to as ectopic due to their placement outside the pituitary, may also cause Cushing's. Some of these are associated with inherited disorders such as multiple endocrine neoplasia type 1 and Carney complex. Diagnosis requires a number of steps. The first step is to check the medications a person takes. The second step is to measure levels of cortisol in the urine, saliva, or in the blood after taking dexamethasone. If this test is abnormal, the cortisol may be measured late at night. If the cortisol remains high, a blood test for ACTH may be done. Most cases can be treated and cured. If due to medications, these can often be slowly decreased if still required or slowly stopped. If caused by a tumor, it may be treated by a combination of surgery, chemotherapy, and/or radiation. If the pituitary was affected, other medications may be required to replace its lost function. With treatment, life expectancy is usually normal. Some, in whom surgery is unable to remove the entire tumor, have an increased risk of death. Symptoms include rapid weight gain, particularly of the trunk and face, with sparing of the common signs include the growth of fat pads along the collarbone, on the back of the neck and on the face. This is called moon face. Other symptoms include excess sweating, dilation of capillaries, thinning of the skin and mucous membranes, purple or red striae on the trunk, buttocks, arms, legs, or breasts, proximal muscle weakness in hips, in shoulders, and hirsutism, which is facial male pattern hair growth, baldness or extremely dry and brittle hair. In rare cases, Cushing's can cause hypocalcemia. The excess cortisol may also affect other endocrine systems and cause, for example, insomnia, inhibited aromatase, reduced libido, impotence in men, and amenorrhea, oligomenorrhea, and infertility in women due to elevations in androgens. Studies have also shown that the resultant amenorrhea is due to hypercortisolism, which feeds back onto the hypothalamus, resulting in decreased levels of GnRH release. Many of the features of Cushing's are those seen in metabolic syndrome, including insulin resistance, hypertension, obesity, and elevated blood levels of triglycerides. Cognitive conditions, including memory and attention dysfunctions, as well as depression, are commonly associated with elevated cortisol, and may be early indicators of exogenous or endogenous Cushing's. Depression and anxiety disorders are also common. Other striking and distressing skin changes that may appear in Cushing syndrome include facial acne, susceptibility to superficial fungus infections, and the characteristic purplish, atrophic striae on the abdomen. Other signs include increased urination, persistent high blood pressure, and insulin resistance, leading to high blood sugar and insulin resistance, which can lead to diabetes mellitus. Insulin resistance is accompanied by skin changes such as acanthosis nigricans in the axilla and around the neck, as well as skin tags in the axilla. Untreated Cushing syndrome can lead to heart disease and increased mortality. Cortisol can also exhibit mineralocorticoid activity in high concentrations, worsening the hypertension and leading to hypokalemia and hypernatremia. Furthermore, excessive cortisol may lead to gastrointestinal disturbances, opportunistic infections, and impaired wound healing related to cortisol's suppression of the immune and inflammatory responses. Osteoporosis is also an issue in Cushing syndrome since osteoblast activity is inhibited. Additionally, Cushing syndrome may cause sore and aching joints, particularly in the hip, shoulders, and lower back. Brain changes such as cerebral atrophy may occur. This atrophy is associated with areas of high glucocorticoid receptor concentrations such as the hippocampus and correlates highly with psychopathological personality changes. Some changes are rapid weight gain, moodiness, irritability, or depression, muscle and bone weakness, memory and attention dysfunction, osteoporosis, diabetes mellitus, hypertension, immune suppression, sleep disturbances, menstrual disorders such as amenorrhea in women, infertility in women, impotence in men. hirsutism, baldness, hypercholesterolemia, hyperpigmentation and Cushing syndrome. Cushing syndrome due to excess adrenocorticotropic hormone, its short term, ACTH, may also result in hyperpigmentation. This is due to melanocyte-stimulating hormone production as a byproduct of ACTH synthesis from pro-opiomelanocortin. Alternatively, it is proposed that the high levels of ACTH, beta-lipotropin, and gamma-lipotropin, which contain weak MSH function, can act on the melanocortin-1 receptor. A variant of Cushing's disease can be caused by ectopic, extrapituitary, ACTH production from, for example, a small cell lung cancer. When Cushing syndrome is caused by an increase of cortisol at the level of the adrenal glands, negative feedback ultimately reduces ACTH production in the pituitary. In these cases, ACTH levels remain low and no hyperpigmentation develops. Causes: Cushing syndrome may result from any cause of increased glucocorticoid levels, whether due to medication or internal processes. Some sources, however, do not consider the glucocorticoid medication-induced condition as Cushing syndrome proper, instead using the term Cushingoid to describe the medication side effects which mimic the endogenous condition. Cushing's disease is a specific type of Cushing syndrome caused by a pituitary tumor leading to excessive production of ACTH. Excessive ACTH stimulates the adrenal cortex to produce high levels of cortisol, producing the disease state. While all Cushing's disease gives Cushing syndrome, not all Cushing syndrome is due to Cushing's disease. Several possible causes of Cushing syndrome are known. Diagnosis: Cushing syndrome can be ascertained via a variety of tests which include the following. They are: first test is 24-hour urine-free cortisol. Second test is dexamethasone suppression test. Third test is saliva cortisol level test. Treatment: most cases of Cushingoid symptoms are caused by corticosteroid medications, such as those used for asthma, arthritis, eczema and other inflammatory conditions. Consequently, most patients are effectively treated by carefully tapering off the medication that causes the symptoms. If an adrenal adenoma is identified, it may be removed by surgery. An ACTH-secreting corticotrophic pituitary adenoma should be removed after diagnosis. Regardless of the adenoma's location, most patients require steroid replacement postoperatively, at least in the interim, as long-term suppression of pituitary ACTH and normal adrenal tissue does not recover immediately. Clearly, if both adrenals are removed, replacement with hydrocortisone or prednisolone is imperative. In those patients not suited for or unwilling to undergo surgery, several drugs have been found to inhibit cortisol synthesis, but they are of limited efficacy. Mifepristone is a powerful glucocorticoid type 2 receptor antagonist and, since it does not interfere with normal cortisol homeostasis type I receptor transmission, may be especially useful for treating the cognitive effects of Cushing syndrome. However, the medication faces considerable controversy due to its use as an abortifacient. Removal of the adrenals in the absence of a known tumor is occasionally performed to eliminate the production of excess cortisol. In some occasions, this removes negative feedback from a previously occult pituitary adenoma, which starts growing rapidly and produces extreme levels of ACTH, leading to hyperpigmentation. This clinical situation is known as Nelson syndrome.
Thank you for listening Dr. Izzy's medical podcast series. If you want to support this project, please subscribe the channel and like this video. Thank you.